Alcohol is part of our culture and it helps people socialize and celebrate their heritage. But drinking too much alcohol on a single occasion can cause serious consequences to our bodies. Alcohol is a complex drug which affects all organs and tissues in our body. Today I'm going to talk to you about the patterns and health risks of alcohol abuse. According to the Centers for Disease Control and Prevention, otherwise known as the CDC, there are approximately 88,000 deaths in the United States that are related to alcohol use. There are two patterns of drinking: binge drinking and heavy drinking. Binge drinking is the most common pattern of excessive alcohol use. It can also be defined as drinking large amounts of alcohol in a single session. Statistics show a binge drinker for men would be consuming 5 or more drinks in a single session. A binge drinker statistics for women would be 4 or more drinks in a single session. Heavy drinking can be defined as more than 1 drink per day, but no more than 7 drinks per week. Heavy drinking statistics for women would be more than 1 drink per day on average, and for men it would be more than 2 drinks per day on average. According to the dietary guidelines for Americans, always drink alcohol in moderation. Excessive alcohol use has immediate and long-term effects that increase the risk of harmful health conditions. These immediate effects are often caused by binge drinking. One immediate effect is unintentional injuries. An unintentional injury is an injury that is unplanned. Some examples of an unintentional injury would be a traffic injury, a fall, or a burn, or an unplanned weapon exchange. Another immediate health risk would be alcohol poisoning. Alcohol poisoning is a medical emergency that results from high alcohol levels that suppress the central nervous system, and it can cause loss of consciousness, coma, and often death. Lastly, violence is the immediate health risk. According to the Centers for Disease Control, about 35% of victims say that offenders were under the influence of alcohol. Over time, excessive alcohol use can lead to the development of diseases, impairments, and long-term problems. Cancer of the mouth, throat, esophagus, liver, colon, and breast is a long-term effect. In general, the risk of cancer increases with increasing the amount of alcohol consumed. Due to excessive drinking, one can experience social problems. Social problems could be anywhere from unemployment, loss of productivity, and family problems. Lastly, liver diseases is a long-term effect caused by excessive drinking. Some problems could be cirrhosis of the liver, which is among the top 15 leading causes of deaths in the United States according to the Centers for Disease Control. There's good news though. There's a variety of lifestyle changes that can help treat alcohol-related effects on the body. But the most critical lifetime change is abstinence from alcohol. Alcohol is a part of our culture and it helps people socialize and celebrate. As we have seen, alcohol has many negative related effects on our body and our health. Abstinence from alcohol can reduce the risks on our body, so it's important to keep in mind that avoiding drinking helps minimize the burden on your body and your health. Five oh two.